Well, there's two main organizations. One is called No Shave November, and one is called November or Movember. Now, No Shave November is a time when men are supposed to embrace their hair. It is a time when men are supposed to raise awareness for cancer. Now, why are men supposed to embrace their hair? Because the hair is what's often lost when a cancer patient is being treated. And so a man, if they embrace their hair, that'll bring remembrance to the people who are suffering from cancer. Now, Movember, its main focus is bringing awareness to men's health issues. And we'll talk about those, but namely this year, talking about mental health, prostate cancer, and testicular cancer. Now, at HIMG Urology, we're kind of embracing both of those because we're doing the No Shave November, but we're focusing on men's health issues. And what we want to do is to take the money that we would normally use for grooming and then donate to a charity of our liking, like the Live Strong or the Jimmy V Foundation for Cancer Research or American Heart Association. So whatever we're not using in shaving cream and razors, take that money and donate it to a good cause.
And probably in the most practical sense, though, the benefit from this is a man comes up to you and says, "Hey, you're growing your beard out. Why are you growing your beard out?" And you can share with them the story about the importance of men's health.
It's a great segue. And actually, just before I came down here, I was walking through the pre-op area at the hospital, and they asked that question, "Are you doing No Shave November?" And I said, "Sure, and this is why."
Why is men's health deserving of a special month in and of itself? In general, are men less healthy than women?
Actually, men are. And on average, men die between 5 and 6 years sooner than a woman does. Actually, 1/3 of men have coronary artery disease. A sobering thought is that 12% of men 18 years or older are considered in poor health.
At what point in a man's life should a man start to be concerned about prostate cancer, considering it a possibility, and then starting the process of screening for it?
Well, first off, 1 in 8 men have prostate cancer or get prostate cancer. And a man starting at the age of 50 should be screened. They should ask their doctor about a PSA, about a rectal exam. That should be the first conversation. Now, if your brother, your grandfather, your father has prostate cancer, you need to move that up to about age 45. Now, if you're an African American, then you need to start screening at age 45. Treatment of prostate cancer is very important. And there's a push in society to not screen for prostate cancer. And I'll be honest with you, we're going to lose a generation of men because these men are being diagnosed later and later in their stages. And even in this short period of time, we're seeing a stage migration. What was early detection of prostate cancer, these men are now being diagnosed sometimes with metastatic disease.
We also want to talk about a cancer at the other end of the age spectrum, and that's testicular cancer.
Testicular cancer is very important. And in fact, it's the most common malignancy in men 15 to 34. And then really the best way to screen for testicular cancer is to know your anatomy. You need to do regular self-testicular exams. We need to know what normal is so that when something comes up abnormal, it just, wow, I need to know what's going on. And then that leads into an examination by a urologist.
Are there key differences in men's mental health and women's mental health?
I think to some degree there is, in the sense that men tend to be silent. They tend to take things on themselves. They try to solve their own problems. And as a result, they often suffer the consequences of that silentness. There's going to be 800,000 people who are going to commit suicide this year worldwide. That's 1 every 40 seconds. It's an epidemic. And in fact, if you look at the middle-aged population of men, the rate of suicide over the last 15 years has gone up by 43%. Why is that happening? I'm not sure. There's a lot more stress in society. There's a lot more going on. I think that men need to start checking in on their buddies. I share activities with my friends, and my friend Steve down in Atlanta, just the other day I just checked in. I says, "How you doing?" Or "What's up?" You know, just something like that. And he asked me, he says, "Why are you asking that?" And I just wanted to know. I wanted, because he's a pastor and he's under a lot of stress, and I just wanted to check on him. And I think guys as a whole, and that's what Movember is talking about, is we need to start checking in on people and just determine what their status is.
Some great advice. Thank you for sharing that with us.